everyone. Welcome to Move Well, Live Well. We get a number of people that come in here with issues regarding their low back. They have low back, chronic low back pain. And it's back pain that kind of won't go away. You know, they've seen the chiro, they've seen the physio, they've gone to their MD for meds, all this stuff, and they just have pain in the back that kind of won't go away. Well, what we're finding with these folks is not so much that their low back is weak, causing low back pain. Their low back is actually strong. But what we're finding weakness in the latissimus dorsi muscle, or the lats, as well as the gluteus maximus, the glute muscles. I brought out good old Netter here. This right here is Netter. This is the Atlas of Human Anatomy by Frank Netter, MD, right there. And I turned it open to this page. I want to just show you guys this so you have an idea what I'm talking about here. So here we go. Right in here, this is your back side. This is the back of your head up here. You can kind of see the little bony protrusions here. This is your spinous processes right here. Now, this is your low back. See this? And we're finding that the strength in the low back is good with these folks, but their ability to generate force in the lats and the glutes are decreased. And if you can see here on Netter, this lat muscle, latissimus dorsi, attaches to the thoracolumbar fascia. You see this white fascia here. And then also the glute maximus attaches to this as well. And when they contract, when you can get them to contract, they help stabilize the low back. So, but what we're finding with these folks is they're having an inability to activate these guys. So, how do you fix that? How do you fix their lack of ability to generate force with those two muscle groups? So that way it helps support the back. The poor back is working hard all day long, whatever it is they're doing, but then those other muscles are just shut down and they're defacilitated, and man, your back is chronically tight, painful. They're seeing the massage therapist, it's not going away. They're going to their chiro, they're getting adjustments, it's not going away. And they're getting their physio, they're getting some exercises, it's not going away. Well, I'm gonna show you 2 exercises that'll help wake these guys up. This one, the latissimus dorsi, and the glute maximus, so that way they help support that thoracolumbar fascia. It'll tighten it up right here and help support that low back, so that way low back pain, chronic low back pain, gone. The first exercise to activate the lats and the glutes simultaneously to help protect the low back are supine butterfly glute bridges with lat activation. I know, that's a mouthful. We're trying to work on that. Maybe if you guys can come up with an acronym, that'd be great. Anyway, so this is what you do. You start out in this position here. Start out in the butterfly position here, just like this. And so you're here, just like this in the butterfly position. And then you're gonna go into your supine, you're gonna go into your glute bridge in here. And the idea behind this, when you're doing your glute bridges, you wanna make sure you're not arching your low back. You don't wanna go into hyperextension. Your pivot point should only be in your hip. So squeezing the glute and pivoting only in the hip and not in the low back. So that's the first step with this. Now you're gonna add lat activation as you do this as well. So you're gonna be pushing your upper arm, your elbow, into the mat. So you're going to hip extension here like this, and then as you're going to a full contraction of the lat, pushing the elbow in the mat, you're gonna come down, keeping this pushed into the mat, boom. Just like that, hold for 2-3 seconds, down, hold 2-3 seconds, down, hold 2-3 seconds, down, keeping the elbows contracted the whole time. You can test it too. You push your elbow into the mat like that, you can feel your lat contract. That is an awesome exercise, the first exercise to help contract the glutes and the lats at the same time to help protect and support the low back. The second exercise to activate the lats and the glutes simultaneously to help protect the low back are super angels. Now, what the heck are super angels? Well, what you're gonna do, you start facing down first. Here you are. So you're gonna lay face down just like this on the mat. You go ahead and lay face down just like this. And just like you're doing Superman, you know, the exercise where you're doing this like this. Well, what you're gonna do, you're gonna start off with your glute contracting right there. So here you are. A great cue is like you're gonna extend the knee. The knee is gonna be locked out. And a great cue is that heel is being pushed toward that wall back there. So legs are off the mat, thighs off the mat, and you're pushing that heel toward that wall. Your arms are gonna be up above you like this with off the mat. And chest is off the mat as well. And your hands, your palms are gonna be face up like this. And you're gonna go into like an angel. See that? Your arms are gonna be swinging big circles like this. And as you get right here, you're gonna squeeze that lat. Oh, like that. And then up, keeping the arms up, big circle. And then squeeze that lat as you get down there. That. And then squeeze that lat as you get down there. And man, I can really feel the activation of my glutes and my lats with that particular exercise. So, those are 2 great exercises to help activate the lats and the glutes at the same time, wake them up to help protect the low back, support the low back, the 2 biggest muscles in the body to help support the low back. Do 1 set of 15 to start, work up to 2 sets of 15, and then 3 sets of 15. Add that to your workout, and man, chronic low back pain, gone. If you have any questions with this video, drop it off in the comment section below. We thank you for watching. We appreciate it. If you're new here, hit subscribe. And when you hit subscribe, make sure you hit that bell notification button because that'll keep you in the loop with subsequent videos coming here in the near future. And that way you can continue to move well, live well. Also, I know you know folks who are battling chronic low back pain. They've seen everybody. It's not getting better. They may have a problem with activating the biggest muscles in the body, the lats and their glutes. Share this with them. Sharing is caring. It's very hard to see your loved ones, friends and family members suffer. So share this with them. Also, give us a thumbs up. Give us a like. It lets us know you care. Thank you for watching. We appreciate it. We'll see you next time. Take care. Bye-bye.